all across America and around the world. This is Veterans Radio. This is Veterans Radio.
Good day. I'm Jim Fausone. I'm the officer of the deck today here on Veterans Radio, and thanks for joining us. We've got some interesting stories for you. We always want to remind you you can find more about Veterans Radio at its Facebook site or at the web, veteransradio.org, where we're on the web 24/7. You can find a lot of our podcasts there as well. We post new ones every Tuesday, so you can get a new story, a new interview, something you didn't know before by going to veteransradio.org. And before we get started, we want to thank our sponsors. First up, we want to thank Legal Help for Veterans. Legal Help for Veterans fights for veterans' disability rights all across the nation. You can reach them at 800-693-4800 or on the web at legalhelpforveterans.com. We just want to remind you that Veterans Radio podcasts are available on all your favorite streaming platforms, including RSS.com, Apple Podcasts, Spotify, YouTube Podcasts, iHeartRadio, and Rees Across America Radio. So wherever you are, you can find us, whether it's on your mobile phone or your computer or your laptop, your tablet. But listen in to Veterans Radio Podcasts. We post something new every week, and you're going to find it informative. Welcome to Veterans Radio. I never thought I'd have a talk about low T, but leave it to the Secretary, Pete Hegseth, to bring this issue to the forefront, which had me go out and find a medical doctor who would talk about testosterone. Yes, I never thought I'd have this discussion. We want to welcome to Veterans Radio Dr. Robert Kelsch. Doctor, welcome to Veterans Radio.
Well, thank you for inviting me.
Well, you know, it's one of those things where sometimes there's something in the news you just have to talk to your veteran radio listeners about. This is certainly one of them. In the last week or so, the Secretary Hegseth did a video and said that, yep, he's going to have mandatory testing for soldiers over 30 to be screened for testosterone deficiency. Now, I went and looked for, okay, there must be a written plan for this. At the moment, there's nothing but this video statement. Nothing defines what testosterone deficiency is, or are we just talking soldiers? Are we talking airmen? Are we talking guys in the Navy? Who are we talking about this? And what the hell is testosterone deficiency? So that brings us back to the good Dr. Kelsch, who's willing to humor me on this. He did his undergraduate at Wayne State University. He did his medical school at the University of Michigan. His academic activities for a long time, decades, was relative to the brain and the reproductive system. That caused him to intersect with the whole issue of hormone deficiency. After a while, he got elevated into administrative roles. He's held a number of those, including Executive Vice President for Medical Affairs at the University of Michigan Health System. He was also the Vice President of Health Affairs at the University of Iowa. Very accomplished. Bob, we're not going to get into all of it, but when you read this article and you and I bumped into each other, you said, I got to tell you about this. So that's where we're at. I don't even know where to start with this pronouncement, this video pronouncement of we're going to test our war fighters to ensuring you have the right testosterone levels to operate at your absolute best.
Right.
Okay, let's start with this. What does testosterone really do?
Well, testosterone is the major male hormone, not the only one, secreted by the testis. And it gets into our bloodstream and it helps us build muscle mass. It makes us more aggressive, more masculine. It helps us develop our reproductive parts of our body so that they can function so that we can reproduce. So it is a very, very important hormone, and it leads to, feeling stronger and masculine behavior. hair growth, facial hair growth, etc.
Does everybody have the same level of testosterone as their normal baseline?
Absolutely not. By the way, both genders have testosterone and both genders have estradiol. Those are the two major sex hormones. There are other hormones, but I won't try to make it too complicated.
Don't make this a medical lecture. Remember, you're talking to
I know.
veterans,
Right.
grunts. You were in the Navy Reserve, or issued out as a lieutenant colonel. Your son did 6.5 years in the Navy. He was on the USS Iowa when it had that explosion. So you know veterans, you know military guys. So don't give us the medical lecture. Explain it to us like we're as dumb as we are.
Okay. Well, maybe I would like to just start, if you will give me a second, to say that this video clip, which I saw on television, really upset me. It upset me because it was making uh, me worry about blurring good medical therapy for someone who needs something with optimization of performance in an artificial way. And I think that's the downside of this mandatory quote ruling or proclamation. And it's the mandatory aspect that bothers me the most. But let me tell you a little bit about testosterone measurement. First of all, when we are a little baby boy, you actually have a high testosterone when you're born. It goes way down to almost nothing after the first few months of life, and then it resurges during adolescence, first during the evening while you're sleeping, and then it reaches its peak usually between late teens and late 20s. And after that, after age 30, your average level of testosterone goes down about 1% per year for all of us. So as we get older, we're just not as vigorous in a masculine sense as we were when we were 25. So that's the normal pattern. The levels of testosterone in your blood do vary throughout the day. So the time of day that you measure it is important. If I'm taking care of a patient, I would want to measure the testosterone in the morning and then repeat it again maybe a week later because it varies. And without too low measurements, I wouldn't even consider treatment. Now, what's low? It depends on how the laboratory reports the level. It either reports that it's 3 to 10 or 300 to 1,000. And I won't go into the units because that's kind of confusing. So if 3 is the lowest level, there's still several percent of people that are still normal, but they're a little bit less than 3. And if it's 10, there's still a few percentage above 10. So ranges only cover usually 95 to 97% of people. But if it were persistently below 3, and if the patient coming to me said, well, I'm feeling tired, I'm feeling down, I'm not sleeping well, whatever, if he had symptoms, if you were having difficulty really enjoying sexual activity, all those things would make me worried that maybe something is going on. And then we'd spend a lot of time talking about his lifestyle because it's usually lifestyle changes that lead to low T, borderline low T. I'm not talking about a severe patient who might come in and have almost immeasurable T. Those are the sort of patients that I would go right ahead to put them on testosterone replacement therapy. But many, many things can cause a quote borderline low testosterone level, especially if you're only measuring it on one occasion, especially if you're not measuring it in the morning.
And I've done some reading that one of the things that impacts testosterone may lead to a lower T number is stress. Is that right?
Absolutely. Chronic stress will decrease sexual performance in both genders. In women, it often leads to loss of menstrual periods. In men, it's just a slow compounding effect of how stress hormones, which come from the adrenal gland, interact with reproductive hormones, and you shut down your reproductive capacity somewhat.
There's actually something in the literature, we've bumped into this in our practice about veteran disability operator stress, that those who have been deployed and on a heavy tempo in combat, maybe they're special operators, they have such a load of stress that it leads to various things, and I'm taking it can lead to low T among other things.
Yes, any type of severe stress, and certainly that would be regarded as very severe stress. And you wouldn't want to then I would want the service to help take away the stress and let nature bring it back up, rather than try to enhance performance and make someone perhaps overly aggressive and not as rational.
And still in a stressful situation.
Right.
Yeah. If you have, and we don't know how this program's supposed to work, there was something about, testing is mandatory, but treatment is not. Give me your reaction to that kind of thinking.
Well, that really worried me a great deal, because the treatment decision should be between the soldier, or the patient in this case, from my perspective, and the doctor. And you shouldn't go into the testing thinking that you need treatment, because, for example, someone who's a little bit overweight and has sleep apnea would be much better handled by recognizing that the sleep apnea and the stress and the sleep deprivation are causing the low T. So you go for the root cause rather than trying to treat a lab result, which is the result of something else.
It makes total sense. And one of the other things I'm thinking about is who's having this mandatory testing, because when you go and check, only about 20% of the Army really constitutes combat forces, and only about 60% of the Navy does, and 33% of the Marines do. And some of this is function of size, right? Army's big, so it has a smaller percentage. But in any event, it's not every soldier, sailor, or Marine that is as Hegseth likes to say, war fighter, age 30 and above. Does this turn into some sort of competition? I mean, have you had patients go, "Oh, I want my T level higher"?
Well, that's exactly one of my fears. You're saying it better than I could have. I fear that once, I'm going to say young men. I don't mean this in a sexist way, I guess. But young men tend to be competitive. I was very competitive, especially at that age. And if you know it's mandatory and you're all on the line, like I had to do when I was going through my military exams, you're always competitive. And then you're going to ask the guy, well, what was your T? Oh, well, mine was 3.2. Only 3.2? You ought to get treated. Right. I think that's exactly the sort of behavior that I really worry about.
Dr. Kelsch, help us understand, too, what is this treatment? How does one treat for this? And I don't know how that works in the field and all of that. Give us some medical guidance here.
Okay, testosterone is a type of hormone. It's I won't go into the details, but it's a hormone that is comes from cholesterol. All sex hormones are types of steroids. Stress hormones are type of steroids. So testosterone, in order to be treated, to be effective, has to get into your bloodstream. And the usual pills that we used for many decades were kind of dangerous, because they went through your intestinal tract, and then they immediately go to the liver, which had a high rate of liver problems. So we don't use those anymore. So we're left with finding a way to get testosterone into your bloodstream and avoiding the liver. The ways you do that are by giving injections. You can use a nasal gel and rub it on various parts of your body. You can use a nasal gel and put it in your nose about 6 times a day if you want to go through that trouble. Um, or you can use a patch, which would be visible somewhere because it'll be a pretty sizable patch. And that they all have problems. The gels have the problem that if, let's say you were putting it in your nose and it comes on your cheek and your wife starts kissing you, you're going to pass testosterone over to her. The skin patches cause irritation. The injections are very inexpensive, very effective, but they give you a sudden burst and they don't smooth things out very well. So a lot of people don't like the fact that a couple of days after the injection, they're really jacked up. I can't think of a better term.
Right, right.
And then it smooths out, and then 2 weeks later, they're down again. So you got to get the injection every.
Yeah, is this something you have to do like every day, every week, every month, once a year? What's the?
No, if you start giving a normal person a testosterone regimen, you might give them something like 100 milligrams every 2 weeks intramuscularly. And actually, my patients, I would show them how to do it, and they could do it themselves, either they or their partner. But these are people that had no testicular function, okay? And they could live a very good life that way. Once you start giving testosterone to a normal person, it shuts down their own testosterone production.
Oh, great.
Okay, so the testosterone gets into the bloodstream, feeds back onto your brain, makes you more aggressive, lifts your spirits up perhaps, but it shuts down your own hormones that go down to the testes to make it work. So your testes get a little bit smaller, and you're then tempted to increase the dosage even above the average dosage. And so you become testosterone dependent, even though you're normal.
And when you stop, what happens? I do this for a year or two, the next administration says this is crazy. We're not paying for testosterone replacement therapy. What happens?
Well, there is a shutting down of the system, but it usually comes back. But it'll come back probably at a lower level because you're older and because it's naturally going down anyways. And then you're back to where you started. And if you have a different root cause for the low T, you still haven't handled anything.
Yeah, you've not dealt with the root cause, whatever that is, medically, psychologically, stress-wise, what have you. That's, as we said at the start of this.
Yeah, it's very, very worrisome, the lacking any other details about how they would do it. And I'm pretty confident there are good physicians in the service that I would trust that they wouldn't let this get out of hand.
Well, and not every medical association's weighed in yet, but I do see I have a statement from the American Urological Association says that while it appreciates the administration's understanding of the importance of screening men for testosterone deficiency, although, quote, the diagnosis of testosterone deficiency should not be based on a single blood test alone, but merely serve as a baseline value for individuals who warrant further evaluation. In political speech, that's a pretty. That statement says we think this is a bad idea, but they can't say that out loud as a professional association, I suppose.
Yeah, well, I hope that I, as an American citizen and the father of a vet, can say that I think this is a bad idea.
This leads into something else that I think this pronouncement, with Hegseth, and we haven't even talked about JF Kennedy Robert Kennedy, who are proponents of these kind of things. But the journal of social science and medicine is saying, has published, that young men are being aggressively targeted online by influencers and wellness companies promoting hormone tests and treatments as essential to being a real man, despite screening for low testosterone being medically unwarranted in most people in that age group. And I'm sure you've seen them. I've seen them, ads on TV, on the radio, on the internet, for not necessarily testosterone, because that pulls them into the FDA, right? But supplements for this.
Right.
Can you talk a little bit about that aspect of this low T advertising that's going on?
It's appalling. It's appalling. Most of the supplements, and I've spent a little time looking up the ingredients of most of them, do very little, if anything, and they cost a great deal amount of money. But there's always a placebo effect. So if you give anybody a sugar pill, about 30% of the time they're going to feel better. Now, those supplements that do not contain, well, those supplements usually contain a plant extract, one that might make you feel a little less anxious, not much, and some other things that sound like they have testosterone, but they don't. And they don't actually have a hormone in them that works like testosterone. Some supplements, though, have dehydroepiandrosterone. That's sometimes known as DHEA. DHEA. And that is a natural hormone made by men and women. It's primarily made by the adrenal gland, but it's a male hormone. In fact, most of the hair growth, body hair of women is due to the adrenal gland male hormones. But it's a steroid. We would call it a natural anabolic steroid. And that you can buy over the counter. And unfortunately, there's no regulation about it, and you can take large doses of it. And it'll lead to a lot of acne, muscle building, so forth. And it'll, like testosterone, it does shut down your own testosterone production. So I would advise everyone to stay away from DHEA unless you have some other medical reason that would really warrant it, and that would be rare.
Here's a question that pops up as you go through this, whether it's actual testosterone replacement or these fake, quacky supplements that are advertised on TV. Do you have a sense of what the percentage of the normal male adult population really has low T?
No, I don't have that. But as I age, I think I'm still low. I'm aging. I think I'm low, but I'm normal.
That's what I mean. I sort of like what if you listen to some of these things, you think, my God, 98% of young men have low T, and that just can't be the case.
No, that can't be the case because it would be a small percentage that would really have a medical reason to have low T. Most of the time, if someone is very, very ill, if they have a severe illness, like anyone under chemotherapy, they're going to have a low T. Okay. Anyone under severe stress, severe sleep apnea, severe obesity leads to decreased reproductive function and low T. Why? Because the testosterone that you make is actually turned into female hormone in the fat tissue. The fat tissue has that capability, and the estrogen shuts down the reproductive system. So losing weight, getting good sleep, good nutrition, something to manage the stress, all those things are going to be common enough that you're going to find some people that will have a T just below the normal range. And those are the ones that you don't want to treat aggressively until you figure out the root cause.
Time will tell whether or not this initiative gets any legs and goes anywhere. But I have to call into question and really hope that they're thinking about. Hegseth says this initiative is not about artificial enhancement. It's about restoring and optimizing your natural capabilities, protecting your longevity, ensuring you have biological foundation required to sustain the fight. Boy, that's a lot of salesman words, and I don't think I hear a whole lot of medical science behind it. And Dr. Kelsch, as we talk, I'm sort of left with that impression as somebody who's spent their professional life in this area. You don't see a lot of medical-based reason.
If it were not unethical, and you wanted to have the best football team in the world, you might want to do this, okay? But that would be totally unethical, and this strikes me as being unethical if that's the goal, and that's really enhancement therapy.
Yeah,
there is no evidence at all that this will improve longevity. None at all. And there's a worry that it'll actually decrease longevity because of cardiovascular risk, although that's not really firmly been proven.
Well, it's an interesting area pushed into the news by Secretary Hegseth. As I said, I thought I'd never have a conversation about low T on Veterans Radio.
Right.
But, Bob, I really appreciate you bringing your medical expertise to the table and informing our Veteran Radio listeners about some of these important issues.
Thank you. Thank you for having me. My pleasure.
And I want to thank everybody for listening to Veterans Radio today. I am Jim Fausone. It's been a pleasure to be your host. I'm a veterans disability lawyer at Legal Help for Veterans, and you can reach us at 800-693-4800 or legalhelpforveterans.com on the web. You can follow Veterans Radio on Facebook and listen to its podcasts and internet radio shows by visiting us at veteransradio.org. That's veteransradio.org. We again want to thank our national sponsors, the National Veterans Business Development Council, nvbdc.org, Legal Help for Veterans, a veterans disability law firm with a national practice before the VA, can help you on your claims and your appeals. It can be reached at legalhelpforveterans.com or 1-800-693-4800. We also want to thank our local sponsors. This would include the Charles S. Kettles chapter of the Vietnam Veterans of America, that's chapter 310, VFW Graf O'Hara Post 423, the American Legion Irwin Preskin Post 46 in Ann Arbor as well, the VA Ann Arbor Healthcare System, and certainly the National Vietnam Veterans of America Association. You can be a sponsor by going to veteransradio.org, clicking on the About Us and our sponsors, and help us out. Keep this program alive for the 21 and 22 years. Keep us going for another 20. Thank you.